Good afternoon, everyone. We are excited that you are here today to join us for our webinar, our ClinicTracker Clinical Scribe webinar. We know that everyone has been asking about it. We know that everyone is excited about it. So we have information here. We have everything you need to know about Clinical Scribe today. So please feel free to ask your questions. We do have the Q&A. We do have the chat. Please feel free to raise your hand. Don't be shy to speak out on the microphone. I will allow everyone to speak if you have a question. There will be time during the webinar for questions as well. So please just ask questions and enjoy the webinar and get as much information as you can. And also, we will be available after the webinar to answer support tickets and everything as well. So without further ado, we'll go ahead and get our introduction of speaker and get our webinar started this afternoon.
Yeah, no, that's great. Do we want to give everyone just a couple more minutes to kind of hop in here because I still see quite a few people flooding in here.
Yeah, we'll get started in just a minute. Looks like we got a pretty good group already. We can give just a few more seconds before we get started. Yeah, Ross, looks like we got a pretty good crew here, so I think we can get rolling and do some introductions and allow people some more time to log in. But thank you, Darnell. Good afternoon, and thanks everyone for joining in today. My name is Josh Gordon. I'm the founder and CEO of ClinicTracker, and I'm lucky enough to be joined today by Ross Young, the founder and CEO of Clinical Notes AI, who we've partnered with to bring you this exciting new feature. How you doing today, Ross?
Great. It's great to be here and all the participants that are joining. We've had, you know, uh, quite a few inquiries about this, right, in this new AI world. So, yeah, my name's Ross. I'm the founder and CEO at Clinical Notes AI. We're AI experts, as well as we've clinically fine-tuned the AI, and we partner with fantastic organizations like ClinicTracker to be the back-end technology partner to really help bring your templates to life. So we're excited today to show what we've collaborated on to really bring the future to your organization with what's happening in healthcare and really in some uncertain times with things going on in behavioral health today. So excited to go through it. I think, by the end of the day today, you'll be much more equipped on how to uh, put some use to AI within your practice and organization to bring some benefit there. So excited to be here.
Awesome. Well, we're excited to have you here, and we're excited to see the turnout for the webinar and all there's clearly a lot of excitement about this feature and AI and how AI can help our team and our partner clinics to really do their job and do it more effectively. So let's get into it and talk about Clinical Scribe. It really is a game changer for behavioral healthcare providers when it comes to documentation. So it's built right into ClinicTracker. You're not going to any other system or other screens, and it's powered by AI. So it automates your note taking, keeps everything aligned with the payer and compliance standards, and it takes a huge chunk out of your workload. And we like to think of it as solving the least favorite part of a clinician's day, which is, as we all know, documentation, right? You went into this field to help those people in need and not to spend countless hours writing notes. And the bottom line is that this tool allows you to spend less time on paperwork and more time with your patients. Right? The Clinical Scribe isn't just a fancy transcription tool, right? I'm sure many of you have seen at the end of a Zoom session where you get a summary of the conversation. And that's neat, and I personally find it to be very helpful with all the meetings that I attend, but we go way beyond that, right? Clinical Scribe it's an intelligent, it's chart-aware assistant, meaning it knows about the patient and the session information and the treatment plan goals and objectives. And it also understands the unique documentation needs of behavioral health. So whether it's capturing what's said in real time during a session or helping you dictate structured notes afterwards, it's all about making sure your notes are accurate, compliant, and completed in less time. All right. So with that being said, I will turn it over to Ross.
Great. Thanks, Josh. Appreciate it. Before we get started, we wanted to gather a little bit of intelligence on what your biggest challenge with clinical documentation is today. One of the things we like to do, as we roll software out to customers, is validate that we're rolling out the right thing. We want to build the right thing the right way. And that really involves all of our customers. So we've put this poll together. So if you would please go through and choose which option aligns with you most, so we can get some of that data. We'll share some of this data at the end of the poll as well. And also in the follow-up email post this session with the actual capture. So your participation here is helpful. We'll give another 30 to 45 seconds here for you to fill it out.
Some responses coming in here. Yeah, so it seems like we have a overwhelming winner of spending hours on documentation after sessions, almost 50%.
Wow.
Integrating documentation into my daily workflow at 20, and then the others around the 5 to 15 range there.
Yeah, the daily workflow. And that's the key, right? So the interesting thing, once we end this, the interesting thing about this is when we started off at Clinical Notes AI, right, we built a tool that essentially lived outside of the EHR that, could write the notes in the documentation for, clinicians listening live or dictating. We'll get into that in a minute. But what we found is that it interrupted the workflow a little bit, right? You needed to use your third-party AI documentation tool and then click back to your EHR. Then you had to copy it and then paste it over, which was great. It's way better than writing notes, right? But ultimately, this needs to live within the workflow of your day-to-day, which was the number 2 selection on that poll. So that's why we built this technology to empower organizations that have been helping organizations for decades, like ClinicTracker here. So let's talk a little bit about how this works. The interesting thing, and if you can kind of wrap your head around this new world of augmented intelligence or artificial intelligence, you can really bring your templates to life now. Now, what does that mean, right? Right now, a template or a form is a field that after you meet with somebody or have a patient encounter, you go and you fill out. Well, a major differentiator, what we've done is really kind of put the clinical leadership in control, okay, of what is the AI going to write. Now, first of all, the first time any of you have maybe seen an AI note be written before, it's magic. It's like seeing fire for the first time. But when the rubber meets the road is when it gets to your QM department and you go to a utilization review or a peer-to-peer challenge with the payer, right? What is the quality of what's coming out? You as clinical leadership understand your regulations, your payers, your levels of care, your requirements, the thematic things that you've found in a joint commission or a CARF audit. You know what a gold standard output looks like. So what we do when we say you can bring your templates to life is during the configuration and the setup of this tool, we go through and actually enable you to tell the AI what it should be writing in every single one of the fields for all of your templates. Now we make that easy by packaging an onboarding tool with you. So you get to define that output based on your interpretation and clinical judgment of what the AI should be looking for out of the conversations and encounters that are had between your clinicians and your patients. So there's a little bit of a fear in AI because a lot of it's black box, right? You put something in, it comes right out, and you go, well, why did it say that? Well, we actually crack that open with ClinicTracker. So behind your templates, you get to prompt them and talk to the AI, right? AI is just a tool that's here to stay. It's important that we build, and we're empowering you to do this, but build those AI skill sets within your repertoire of operating in the future of healthcare to align with the ever-moving goalpost of payer requirements and regulations, and then scale that across the organization. We'll talk about that once it's saved. So how does it actually work? Once we do the template configuration and a little bit of that upfront work, You simply there's a little icon, and we'll demo this today, that lives in the ClinicTracker UI that you click on, and then instantly it taps into the audio system of the endpoint or the device you're using, however you're using it in the ClinicTracker portal. Um, it then transcribes a session. Okay, so it listens to it. It actually does not record the audio. We did that to protect you and to protect the client from a privacy perspective as well. It instantly transcribes a conversation. It holds on to that transcript. And then when you click the generate button, it looks at the template that it needs to fill out, the instructions behind each field in that template. It uses the AI reasoning to then populate every one of those checkboxes, drop downs, text fields based on your instructions at the leadership level. So what happens is you really scale your gold standard output across all of your clinicians, and all they need to do is provide care, review the output from the AI, and then save their note or document. The other thing is that what we've really thought through is the lineage of documentation. Okay, so for example, what's required to be in a progress note? Well, it needs to look at the measurable treatment goals or problem list, the medically necessary interventions that are aligned with that measurable progress goal, and then it needs to show evidence of that intervention being used, as well as progress or lack of progress towards those measurable goals to justify the sustained level of care, right? So how do you do that with an individual encounter? See, most AI platforms, when you look at them, you've probably seen some on your social feeds, they just take that isolated patient encounter. Take an isolated patient encounter, they summarize it, they give you a note, goes in the system, and that's it. Well, this is different because it's in the ecosystem of the EHR. What the brilliant team at ClinicTracker have done is push that treatment plan, push that patient information and immunization and all that information so that it's chart aware. And that's a major differentiator when that rubber meets the road and you do get audited on this documentation in the future. It's going to be individualized, chart aware, and golden thread accurate. And then at the end of that, you'll review your document as a clinician. And then if they don't like what's written, they can even talk to the AI scribe again and say, hey, change this, change that, add this, add that. They can talk to the scribe. So think of this, we're personifying technology because it's augmented intelligence. We're now, think of the clinician as now they can talk to the chart. They can go, oh, that looks great, or it doesn't, and change this and that. And it kind of almost puts the EHR a little bit at a second layer, which really enables them to continue to just provide care, and then the compliance and documentation is handled. Okay, I think we can go to the next slide. I tend to go on rants from time to time, but if you have questions, let me know. Okay, so how do we scale compliance across the entire team for every program and level of care, right? So that's where that clinical leadership, when we do that that initial onboarding session, we basically interview you about your interpretation of your regs and requirements that go behind the purpose of each document, okay? Now, once this is in practice, we're seeing reductions of around an average of about 60%. Some organizations post-survey of their staff are seeing reductions well beyond that, right? So the question is, what do we do with that extra time in that regard? You can choose that. You think about the cost of turnover. You think about the cognitive load on your staff of before they write an individualized group note or progress note, they got to look at the chart to make sure it's in line. Well, you can do that on an individual basis, but if you have 8 encounters a day, and think about your group notes, right? And group notes, you got to make those individualized. And oftentimes what you'll find when you do your 5 to 10% QM audits of all your charts is that there's a lot of, so, oops.
All right. You're right. We lost the audio for just a second, but I think you're back.
Okay, great. I think we're back. So it can be monotonous in that regard. So we're automatically taking that golden thread requirement across the board. And then it's going to also really improve the encounter to billable moment, right? If you think about the revenue cycle management and if you're measuring time from encounter to reimbursement, this can really help accelerate that from a cash flow perspective, a revenue point of view for the organization, right? So yeah, so there's more benefits, of course, but those are pretty low hanging fruit. And then let's talk compliance, right? We're in some uncertain times right now, right? You do get audits from time to time. Sometimes you get audited, sometimes you don't. Let's think about, from an IRS perspective, just personally, I do my taxes, but I don't get audited every year. But if I do get audited, that can really blow some things up, right? And in these current federal times that we're in, right, we're all, on our toes about Medicaid, cuts to Medicaid if we're taking that additional, audits coming in and potential recoupments and things of that nature. When you use this category of a tool for all of your documentation, one, it's going to create a very rich chart, right? That has lots of detail. And frankly, there's variance across different clinicians depending on how long they've been in the space, their level of fatigue at the time, about how rich those charts really are. Some people put one-liners, some people, put multiple paragraphs. But this enables you, once you set up those prompts and that are behind those templates and bring them to life, you're going to create consistency across all the documentation, right? From the amount, even the amount, you can even define, hey, make sure this is 4 sentences and includes client quotes and demonstrates medical necessity in the assessment section of my SOAP note, right? You can do that. And then obviously it's fully integrated with your form, so you don't need to go outside of it. So when you use a third-party AI tool, now you're having dual medical records out there. When it lives in the ecosystem of the EHR in that regard, it doesn't leave in that particular way. And then also helps maintain the compliance, whether you're a CAR for a joint commission, if you're dealing with CMS or private payers. Those requirements, you can put them, behind the chart on what the AI needs to look for. So you're going to just scale compliance to the most strict requirements of the organization.
Right. And so ClinicTracker, the EHR, puts a bit of an infrastructure in place, right? So it's not clinicians deciding what paperwork needs to be done and what fields should be collected. And you're not just offering a Word document for people to write information. You're defining that with your form designs and with your workflows that you build. And this takes it a step further, right? So we've already defined our forms and you've already built your forms and defined here are the distinct fields of information we want to capture. This is a way to ensure consistency in terms of the output, like Russ said, by tying in these various capabilities of the Scribe to meet regulations or format things in a certain way. If you want things bulleted versus narrative, you really just, the same way you define your fields when you're creating your forms, you define the prompts that you want to provide to this AI Scribe to help you complete your documentation.
Right. Now, let's talk a little bit about the tech. We want to get to the demo here. So, the AI is also sentiment aware. It's looking for speech. It's especially for those MSEs as well. Of course, it can't pick on appearance, but so you may need to inform the AI of that. Excuse me. Um, but yeah, it's looking for speed of speech and tonality to look for cues from a sentiment perspective. Again, we've talked about chart aware a lot, so the golden thread there. But also, what we're doing on the back end is, AI is moving at more of a rapid pace than any technology in history. Like yesterday, OpenAI, which is ChatGPT, released 3 more models, right, that are much more powerful than previous models. So what we're doing, is taking those models, we are putting them in a HIPAA compliant environment, and then we're fine tuning them very quickly for clinical use. And they're reasoning models as well. So you can ensure that the latest models that are coming out, your team and organization gets access to that latest technology to apply it with reasoning within your organization. So we're prepping that for you. And I imagine the majority of you and your teams have used ChatGPT. You do not want your medical data going to a third party, right? First of all, you need consent if you're going to put that in any third party, type form. And now this just lives within your ecosystem. So it's important, now just from a compliance and ethics perspective that you have AI policies for your organization that, talk about using third-party AI tools. And now that you're offering this inside of your organization, you can cut that out. And frankly, it's kind of wild, wild west on AI right now. So what we've done is helped organizations with some of those policies and are following, best practice standards from security and HIPAA perspective, even though it was created without the concept of even AI being in our world today. So it's important that you address this with your staff and your employees about consent and ethics and what they're using from an AI perspective to make sure that you don't get PHI creep outside of your environment.
Hey,
Great.
Ross, it
So
looks like we have a question in the Q&A.
yeah, go for it.
How does it connect how does it connect the golden thread? Is it based on diagnosis or session outcomes?
Yeah, great question. So, for example, before you write a note or document, what's happening is the previous information from like treatment plan or intakes or assessments that are inside of your EHR already about that client are submitted to the AI prior to it writing that next note or document. So it's writing it in sequence, if you will. Does that answer your question? Feel free to ask a follow-up. Any other questions?
Yep, that answered the question. Thank you.
Perfect. Great. So there's three ways to capture the data. You got ambient AI. What is ambient AI? Well, that's live. So on your endpoint or your device, whether it's a laptop or a tablet or whatever it is, where you uh, that you have near you in your patient encounter, you turn it on. It transcribes and listens live to extract the relevant information to fill out that note or document. The second option is really your AI scribe for dictation. Now, this isn't your typical dragon speak dictation. This is different. Think of as you have a scribe in the room that you're going to, or maybe outside the room after your session, that you're going to talk to write your note for you. So while you're in between patients, whatnot, you can say, "Hey, I met with Ross today. Here's what we talked about. Here's the progress towards goals. Here's what happened during the week and during our session." So you can kind of talk to it just in natural language. What the AI is then going to do is take that information, ingest it, look at the fields out of the form it needs to fill out, use its reasoning to take your data dump, and then fill those out for you. So that's a dictation piece, like you're talking to the actual scribe itself. And you can even combine those as well. And then the third option is an audio upload. Some organizations are recording every encounter already and don't want to use a third party capture tool. Within the platform, you can take an audio file and upload it in to the system, and that'll ingest that and then write the note or document for you.
All right,
Good.
so we've done a lot of ranting or passionate explaining, however you would like to describe it. So let's get to the good stuff. So um, like Ross mentioned, this is all baked right into ClinicTracker. Right? You enable Clinical Scribe, and you're gonna go through your daily routines just as you are doing now, but you're gonna see just a slight difference. Okay, so we're working in Staff Portal. We are recording our appointment. We've come to the point where we want to record our progress note. We're gonna pick our progress note template here. This happens to be a SOAP note type structure, but think of this as whatever progress note you have designed and are currently using or want to be using in your agency. So again, nothing different here. This is what you or your clinical staff is used to seeing, is used to filling out either during a session if they have heads chasing towards computers and laptops and tablets, or are filling out afterwards if they're trying to do their best to recollect the session to fill out the documentation. The only difference that we're going to see here is this new widget icon down here, right? I'm going to click on here. This is the Clinical Scribe widget. And I have a few different options, as Ross was just describing. We can dictate or upload an audio file, which is one option, or we can use the live session tab, which is what it's defaulted to here. Okay. If Ross and I were sitting in the same room having a live session, I would just start like this. Because it's over telehealth, I'm going to choose this option for telehealth, which is going to prompt me to pick the appropriate screen. And then I'm going to have to make sure to share the audio. And that's what's going to allow Clinical Scribe to hear both ends of the conversation. So as I'm talking, you can see this little audio meter go. And Ross?
Yeah. Looks like it's picking us up right now. I'm excited to kind of go through things. Now, one thing I'll add is that you can turn this on before the client even comes into the room to kind of get prepped and ready. The AI is only going to extract what's clinically relevant. In addition, you'll see the language option down there. There's over 40 languages that are supported. So if you're serving diverse communities, the AI will listen in any language and then always convert it into an English-based note.
That's perfect. So we have a question about if someone is very soft-spoken, will this be able to pick up the voice easily?
The answer to that is it depends. Depends, if I just kind of whisper like this, right? Maybe it does, it doesn't. But you'll see that based on the quality of the output. But ultimately, the answer is depends on the environment. I can't just say, first of all, we've tested this to very low decibel. Okay, we've tested this on very old, like 2012 Dell laptop, mics as an example. So we've done a lot of regression testing there, and when it recognizes it's under a certain decibel, we do some enhancement technology with AI. But if it doesn't have the sound, it doesn't have the sound. So I think that's just important. But soft spoken isn't an issue. Accents typically are not an issue either. We've tested it, in multiple different environments, and again, multilingual as well.
All right. So rather than explain or just show you the output, we thought it would be good to do a little role play, a little mock session. So we're going to take maybe 3 minutes here. We're going to conduct a session, myself as the clinician and Ross as the client, and then we'll see how the tool functions here. All right. I'm just going to click the start button. All right, and it looks like it's listening to me, so we'll get started. So, hi Ross. Can you tell me about what brought you into treatment and what the last few weeks in rehab were like for you?
Yeah. Um, I've been out now for about a week and a half, and it's just honestly, it's been kind of rough. Um, you know, I moved back in with my mom since I was, in the residential program before. And I've just been feeling a lot of cravings recently. My mom still has tons of alcohol in the house and she smokes weed. And me trying to be in this environment's really testing my coping skills, and it's just weird being back home again and trying to figure out my life, honestly.
Um, so, what are the biggest changes you've noticed in yourself since leaving rehab, whether it's physically, emotionally, or in your thinking?
Well, when I got out, I was, really excited, to live my life sober, like we talked about, and I've been wanting to start my own mechanic shop and open that up and whatnot. But just, the reality of being back around my mom that, doesn't really care, and my friends and things of that nature. It's just kind of been hard. I feel like I need to break out of it, and I've just been feeling, pretty down. Haven't been sleeping much and whatnot.
What situations or feelings have been the most triggering for you since stepping down to outpatient?
Yeah. Um, well, really just, kind of I feel like I'm just looking uphill, right? I mean, there's so much to do, so I've just been feeling overwhelmed and not really knowing where to start. I know you and I talked about putting together a plan. But I'd like to, kind of start doing that.
What supports do you have in place right now, and are there areas where you feel you need a little bit more help?
Um, well, yeah, it's tough. Like my brother's a pastor, so maybe I can call him. And I've been trying to find a sponsor, kind of like what we talked about. So that's been, you know, it's been a little struggle. I don't know if you could help me with some of that.
I'm sure we can come up with a plan there. But tell me, so what are your goals for your recovery and mental health in the next 30 days, and what would success look like for you?
Yeah. Well, one, just staying sober, of course. And I just don't want to feel like this anymore. So that's been important. Um, and starting my shop, if I can. I got a little bit of money, but I need a little bit more. So yeah, that'd be great. What are some other kind of coping mechanisms, I guess, I could work on? I think we talked about journaling, but what else?
Yeah. Well, looks like we're near the end of our session here, but these are all things that we'll pick up when we meet next Wednesday. And in the meantime, keep reaching out to your pastor, your family there for support, and we will meet again next week. Thanks, Ross.
Okay, great. So
Okay.
yeah, is it still going? There we go.
So we're just going to get a little confirmation screen here. And I'm just going to click this button to have the system start doing its thing, right? And so this is Clinical Scribe taking the input from the session we just had and then using all of those other chart-aware features that it has to know about Ross and his demographics and his history and his treatment plan goals and objectives, along with the session we just had. And then it's going to look at the template that you have designed. It's going to consider the prompts that you have given the template, and it's going to fill things out for you. Okay. And so here we see the results of the AI personal assistant doing its job here. All right. It indicates that just the patient was present. There was no one else. So it can make selections from these kinds of lists. And then based on the template that we've designed and the prompts that we have given it, the system has gone through and filled out the information. Okay. And it's filled out where it can. And there's other places where, we didn't discuss rating scales in the session, so it would leave it blank or put an NA depending on how we had defined the template.
Yeah.
And you'll see it goes through into mental status, and it picked up its best interpretation of the session. It used direct quotes from the client and the session, again, because that's what we had when we talked to the AI and built this. Originally, this is what we told it to do. So you'll see it went through and it filled out any parts of the document that we had suggested it fill out based on the design we've put together. And then we can see here, when we're talking about it being chart aware, here are some of the types of information that the system is aware of, even though we didn't talk about it just here. We didn't cover it in the session. Now,
And I'll give you a second to read some of that as well. If you look at the assessment in there and then you look at the plan, you can kind of see here that it picked up, um, you know, it's looking for barriers to treatment there too, right? So while he demonstrates insight into his condition, has articulated clear recovery goals, environmental triggers remain significant barriers to maintaining sobriety and emotional stability. So I just talked about the environment, right, that I was in. The AI is using that reasoning because it understands that, in the note, you need to show a lack of progress as well. What are the barriers to treatment? So it's using that to put in here, of course. So anyways, I wanted to just call that piece out.
and like any of the features built into the EHR, the way that ClinicTracker lets you load information from one place or another, it's never doing your job for you and locking you into something, right? This gives you a starting point, hopefully a great starting point, that gets you as close to 100% of the way as you can. But you always have the ability for you to make your changes or make your modifications to whatever the output is. All right. And you can do that in a variety of ways. Number one is we look at this and we decide we want to add something in, and you just type or click on this template like you would normally. One of the really neat features here is that you can use this edit with AI, right? And I can actually talk to this personal assistant that I have here and just tell them what I want changed. Okay. And one of the things I've even learned as, I've become, done more of these sessions and interacted with the scribe more often is that if you want something done, just talk to it. Talk to it like you would talk to your friend or your colleague. And it does a pretty darn good job of listening and producing what you want. So just as an example, we'll give this a try here. In the rating scale section, please indicate that the Hamilton Depression Scale showed a score of 15. In the subjective section, please change it from narrative format into a bulleted format. And in the objective section, please rewrite it in the voice of William Shakespeare.
Shakespeare, huh?
Shakespeare.
That's pretty good.
Let's see what we got here.
You
So
obviously wouldn't do that, but yeah, to his point, right? Each of you and your staff now have a, uh, a clinical assistant, right? That's going to now follow your instructions. We've positioned this so that your clinical reasoning and judgment is paramount over the AI reasoning, right? It's going to do a great job there, but anyways, we'll watch what it did here. So it obviously put that in bullet point format and subjective, but it also wrote that in Shakespearean content. Melancholic, it called me.
melancholic, right? So obviously, not something you would necessarily do in practice, but it does show you kind of the power of this tool. So if you want it to align with different regulations or compliance regulations, you can really just talk to your assistant and have it make those changes for you. Now, the edit with AI is something that you might use more upfront when you first start using the system. But if you find yourself making the same requests to the scribe over and over and over, that would be a case where you would actually go back to the template that you had built and the prompts that you've put in and make those changes centrally on the form so that the AI can do this on its own by default without you needing to request that it make changes.
Well, that said, any guys questions or even feedback on, kind of what's happening here? You saw some reasoning happen there. Obviously saw some editing, but yeah, I'd love to see any questions or feedback.
While those are coming in, and Darnell's keeping an eye on the questions there. For those of you that are on the form
John,
building things, and designing your forms, this is a very simple and straightforward change. As you design your form, you put your text box or your list of options, and you have all the properties you can set currently about how to display it and font sizes and descriptions. You'll just have one more section that has AI prompts,
We
right? And
have
those
a live question here.
you know,
We operate a mobile clinic. We're in big RVs, and sometimes there's a lot of background noise. How does it filter that out? Is it
great,
you guys
great
tested that?
question. Yeah, we've tested it in that. We've actually tested it in school environments for play, and whatnot on the playground. It does a great job of prioritizing, the voice. It even though it will pick up sometimes like background voices, it prioritizes based on the theme of what's going on in that conversation and can kind of understand what's happening there. And background noise such as, a loud motor or an AC going in your van, etc. It'll do a great job there in that particular regard. I think you'll be quite impressed with it. And then, does that answer your question, John? Do you have anything else?
Yep. No, thank you.
Okay, great. And then last thing, Catherine, for you, you said, do we need to create all new forms to use AI? Per Josh's question, yeah, he did answer to his point, a separate section that's just called Enable AI, and then you can talk to the AI about what that field is for behind it. And as you move forward, the organization will help you onboard in that regard to make sure that you get it right up front.
And Catherine, thanks for the question. And if you already have designed your templates, there's really not that much to do. The part that's left to do is just to give those prompts. And the system can, figure out reasonably if you have a section that says rating scales, but the prompt to say, I want the AI to complete this particular field, and this is how I want it to complete. And some of those nuances about should I include a client quote? If I don't have enough information, what should I do? Should I, try and create something, or should I say not enough information, or should I leave it blank? That's the process that you'll work through or we'll work through together at the onset, just to make sure that those prompts are configured the way you want it so that the output shows up the best way in line with
That's a
how you do
really good point, Josh. And I think that talking a little bit about what are the risks here, right? We've made it, look fantastic and do reasoning, etc. So what are some of the risks and potential concerns? So first of all, let's talk about AI in general. The most accurate AI in the world is about 90% accurate. And we're talking MIT level AI, fine-tuned, etc. So you're going to get a couple of things, from time to time that may not be accurate on a word that was said or a medication or some things like that. What's important is that when you set the tone for the organization that we're using AI, is that this is augmented intelligence. One, it's not here to replace you. Two, it's really here to assist you, but you need to review. The output before you sign for it. So some organizations even have their clinicians before they use it in a live setting sign a document that says, "Hey, I recognize I'm using AI. I'm going to review it, etc." So, great question, Chad, and hi, Chad. Good to see you on here. Can you use the same
it.
transcription to create multiple notes? Say after the subnote, can you then have an updated treatment plan and then do a discharge summary using the same session? I'll let Josh answer that. I'm not sure if we could do that in this particular case, but maybe.
Yeah, so Chad, good to hear from you. Chad is actually the one who introduced Ross and myself, so thank you for that. Yeah, so not directly from the screen can you transcribe and have it kind of create multiple notes. However, using other kind of built-in features of ClinicTracker and form designs, there are certainly ways to have information flow from one point in the system to another, or to load information from one part to another. So, for example, you might have created your discharge summary that pulls in information from somewhere else in the chart. So depending on how you set all these things up, and some of the more advanced features of Form Builder like reference controls and reference writebacks and things like that, you could in theory set things up so that the information from one location is available either for selection or by default in one of the other templates within the patient chart. Thanks, Chad.
Great. Josh, did you want to? We talked a little earlier potentially about looking at a form. Did you want to do that, or did we want to move on?
We can maybe just touch on that quickly. So if you have, like I mentioned, your form design, what you're going to see is just one new property that says AI prompt. All right. And then this is where you're going to put in your prompt to the system. Again, if you have enough information, do something. If not, leave this unselected. Include a specific client quote, tie back to medical necessity, whatever that happens to be, put in narrative versus bulleted format. So to, I think it was Catherine's question, this is really the change that you're going to see is this one new property to fill out to say, I want the scribe to complete this field, and that's how we're going to do it.
Yeah. Would you mind clicking on one of the text fields, maybe for like the assessment or something, as an example, Josh? Yeah. Great. Okay. So in here is an example. You can be as detailed as you want in here. So it's saying you think of this as you're talking to the AI through the template. So you can say, provide a clinical interpretation of the client's mental health status, assess progress towards treatment plan goals, note symptom severity and any improvements in barrier to progress. So that is the prompt that it gave to the AI. So now it knows what its job is to do to fill out that assessment. So you can again be as detailed as you want in here, but think of this as your kind of giving intelligence to the field, right? Behind it. That then after it listens ambiently to the conversation, it will follow those instructions to complete that field. And this is also why we sometimes we say terms like your AI, your way. You get to build this skill set to work with the AI. Now, if you're like, hey, I don't really want to deal with this, like, I just want the note to be written as an example. We have services from a team perspective to help you get these templates set up for you. So I want to just show you can be as granular as you want here, or rely on our teams.
And I'm gonna throw out the question that everyone kind of jumps to when they hear about AI or there's a new feature, a new tool that comes out. How scared should I be about this, right? I've been a clinician for 25 years. I've been doing things a certain way. Is the goal of this to replace me, or how should tell me why I should adopt this and not be fearful that it's going to take over the world. Ross, you want to field that one?
Yeah, no problem. Sorry, I didn't know if you were going to continue there. So yeah, and that's the thing, right? So first of all, therapists are not going to be replaced by AI, right? There may be some augmented, like, in a value-based care model and things like that can help kind of in between. And we're seeing some of that type of technology come out. But ultimately, that eye contact, human to human connection will not go away. It's necessary, it's needed, etc. Also, this is not here to replace your clinical judgment. It's here to help, and you get to tell it what to do. And that's the beauty behind those prompts is your leadership, your organization gets to tell the AI what to do so that you can actually be more human. You can be more present, more connected with your clients and patients. Because point of care documentation, right? When they're talking about something traumatic, for example, and you need to capture something, or even on the back of your brain when they're talking, you're thinking, okay, I'm going to need to document that. Here's what's happening here. Here's the intervention I'm using, and I need to remember the X, Y, and Z. It enables you to kind of let that guard down a bit and really be present in care, and handle a lot of the compliance stuff and the on the background for you. But yeah, this is augmented technology to help you and yields to you in your clinical judgment.
Yes.
I think there's another
Um,
question about
All right, yeah,
price.
yeah,
looks like
question
we have a
about.
couple questions in there. Let's see.
um,
Will there be a payment plan or a package options, like a top package with all the AI options and maybe some less expensive options with more limited AI options?
Yeah, so the way we'll make this available within ClinicTracker is similar to certain other features like Telehealth Connector and others, where you only need to license it for the specific staff members who will be using the technology or using the feature. So if you have 80 staff accessing ClinicTracker, but only 50 of them are routinely writing progress notes or are interested in using this, you would just need to license for the individuals. And then beyond that, if you have specific use cases you'd like to discuss, just feel free to reach out to your account manager through any member of our support team, and we can put together a plan that makes sense for you.
And also, can this be used on mobile devices slash apps like the image displayed or just the computer?
Ross, I'll let you field that one.
Yeah, well, I'm just curious. I'm not familiar with the mobile experience of ClinicTracker, but is that available? Is the portal available on mobile?
Yes, for sure.
Yeah, so wherever you can access that portal, it'll tap into the audio of the actual device when you click on that little icon. So yeah, if you're using it, on a tablet or something in the field, right? You can click on that and it'll just use the audio of that particular device, so long as you're in the ClinicTracker platform. So yeah, it's native to any endpoint or device operating system that you're using. You may just have to enable the microphone, but that's about it. It'll usually prompt you to do that if it doesn't have mic access, you know.
Right, well, we're letting any final questions come in. Hopefully you've seen the benefits and the opportunities that this tool presents. We've talked obviously about the speed of documentation, um, the compliance, enhancements, how that ties into reimbursements and being audit ready. But in the end, the point of all of this, what you are all doing and what we're trying to help you with is to provide better care. And whether that's you being a little bit more refreshed, being able to focus on the session and not so much the documentation, or even within the session, being able to maintain eye contact with your client without having your face down in a a notebook or a laptop or turning, I've seen it at people at doctors' offices. It's a doctor sitting there and looking over here and asking you questions, right? It just kind of makes it a disjoint kind of interaction. So there's quite a few kind of subtle or ancillary benefits to this capability as well.
Great question about HIPAA. So someone had a question about HIPAA, I think, Josh.
Yeah.
So I imagine each of you probably already have a business associate agreement in place with ClinicTracker. So this is covered under that. The other thing that is important is consent. So if you're going to do live capture, you do need informed consent. We do have an example document that we can provide you to have in your intake paperwork, but you also can get verbal consent, right? Usually from a verbal consent paper, perspective, and when your organization signs up, during the onboarding process, we cover a lot of this with your staff and things like that. But ultimately, something along the lines of we're using an automated note-taking tool to help us with our notes and documentation. It does not actually store any audio. It frankly just helps us with our notes. Is that okay if we use that in our session today? So automated note-taking tool is, really what it is. Yes, it is using AI. You can say that. You don't necessarily have to say that. But AI really is just a technology. And then, again, it's here to stay. It's kind of like using a computer that's on the internet, that's connected to a browser, that's connected to the cloud, right? AI is just another technology that's being used to help create more efficiency in our lives. So uh, there's that particular piece. Let's see, there's a few more questions. Darrell, do you want to kind of go through those questions for us?
Yep. Let's see. Tiffany said would be interested in seeing a survey about how clinicians feel about this feature and how likely they are to use it.
Yeah, great question. Don't have a survey up right this second, but I can tell you that, there's hundreds of thousands of clinicians that are using this technology across the board in the behavioral health space. But typically when we deploy, let's say we deploy to about 100 user organization, we're seeing initially about a 72, 73% adoption rate right out of the gate. And this category of technology is a pull, not necessarily a push, right? There's the pain is so great in documentation, that they typically want to use it, right? It takes a couple of days to get used to it in the workflow, but once they use it and they see the burden that's lifted off, they're very typically excited about it. But a lot of it is from the fear of unknown, right? The ignorance of actually what is happening here specifically, where is it going, that type of a thing. So during the onboarding, those questions are typically addressed. And what we've seen over time is even though let's say that you get about a 70% adoption rate or 72%, you see that creep up because it starts to be ingrained in some of the culture of the clinicians. And then they hear about, the talk in the lunchroom or whatever's going on there, and then they start to see it. So that's also the flexibility from a license perspective that you can work with the ClinicTracker team on. Of kind of where do you start, how do you grow this, etc. We're really flexible in that particular regard. So, anyways, great question. Um,
And to answer the last question, we can certainly send anyone who wants this recording. We can send it to you, so that's not a problem at all. Um, just let us know. You can send a support ticket. Um, I have your information right here, so I'll send that to you. So anyone who wants this recording, please feel free to ask, and we can definitely send that out to you.
Yeah.
Uh,
But from an interest perspective, I'd encourage you right now to scan that QR code and set up your time and your appointment to actually get the one-to-one, kind of questions live demo for you and your clinical staff or other team members to really think about how does this work in my setting? How does this work in my organization, etc. So we do have quite a few demos booked. So I'd recommend, at this particular time, picking your slot, checking with your team, etc. Or what you can do is actually write down that URL right there and put it in your bookmark for after you can connect with your team. You can then schedule your appointment. But again, appreciate the time. Are there? Oh, it looks like there's more questions coming in. We still have some time. Yep, we have.
let's see. Yeah, future plans/areas. AI will be integrated within ClinicTracker other than just progress notes. Is it a learning AI? Will data be integrated to be able to pull?
Yeah, great question. I think this is just the beginning, right? to think about what's the lowest hanging fruit. Absolutely, there's more. But to correct on that question, this does more than progress notes, right? It'll do the intakes, the assessments, etc. Think of any one of the documentation or forms inside of your platform. We showed it on a progress note as an example because it's one of the most common used forms. But ultimately, yeah. There's more to come, and auditing, and there's a lot more, but please stay tuned. This is just the beginning.
And
Uh,
just to piggyback on that, any of your progress notes or any of your patient forms that you've created using Form Builder, like Russ mentioned, intake assessments or anything else, you will have the ability to enable them for the AI.
And if you were unable to scan the QR code or copy that link, I did put it in the chat for everyone. So if you want to take a few moments to copy that. And if you have any other questions, please feel free to ask.
We've seen a good mix of existing ClinicTracker customers that are interested in getting started. We have some who have already adopted that technology already, and the feedback we've gotten so far has been great. We haven't had any pushback to the computer. The AI is scary, and the computer's doing my job. It's the kind of thing that you show people and they get it. Even just in the brief demo we did, hopefully gave you a sense, but sign up, give it a try, and just use it for one session, and see what it does and see how much time it saves you. And you can decide for yourself if this is a helpful tool that would make your job and make your life easier. But like Russ said, this is the beginning. We're very excited about the partnership we formed and the functionality and solutions that we've been able to put forth to our user community. The enthusiasm about this is unlike we've seen with anything we've put out over the last 2.5 decades. This is I remember a couple years ago when there was talk of AI, there was still a lot of hesitancy and it wasn't quite as mainstream. But Ross, you mentioned computers and the internet and cloud computing. I mean, these were terrifying unknown concepts 5, 10 years ago, 15 years ago, right? And now you wouldn't think of doing it any other way. We're at that point where this is really, AI is here. It's here to stay, and it's time to start harnessing the power.
Yep. And Joni had a question about how she can sign up for this. She asked if she should do a ticket or what you would like her to do, Josh.
Yep,
Yeah,
I did go ahead and send her that link.
Oh, you
So
did.
yeah,
Okay.
that link will you just fill out that and that'll get to us. So
yeah. So links, QR codes, phone calls, emails, tickets, however you normally reach out to us, just let us know. We'll be happy to walk you through this, and as part of the onboarding process, we'll work with you any assistance you need in terms of learning how to. Ross has this very fancy term, the AI prompt engineering, right? How to talk to the system to make sure that it understands how you want the output to be. And we're here to support you through that process so that it works exactly and is tuned exactly how you would like to see it. All right. Well, Ross, thank you very much for joining.
Thank you, everybody. It was a pleasure.
Thank you, everyone, for attending.